Minister, let's talk a little bit about health. Now, you served as the chair of CAFA, the Caribbean Public Health Agency. You understand firsthand surrounding health issues in St. Kitts and Nevis. What are the most dangerous threats to the people of St. Kitts and Nevis as it relates to health, and what are you doing locally and regionally to address these threats?
Okay, well, before I answer those questions, let me just put in context what CAFA is. CAFA is an acronym for the Caribbean Public Health Agency, and it is really the merger of 5 individual agencies within CARICOM that had their own discrete approach to managing healthcare. The largest of those 5 agencies is what we in the health system, if you follow the health system for years, would have known as CAREC, which is the Caribbean Epidemiological Center. That is the center in the region. Well, it still functions as that since the merger, but CAREC would be that agency that you would go to get confirmation when there's an outbreak of disease, so that at the first sign of the presentation of that malady, you would be able to have it verified beyond a shadow of a doubt. So, for example, when chikungunya came around over a year ago, CAREC would have done a lot of groundbreaking work in that, even though they didn't have the budget for it, but they had to, because that's the CARICOM's version of the Centers for Disease Control, the CDC, as it relates to the U.S. context. So I became the chairperson of CAFA in March of this year, shortly after the government took office. And of course, the biggest challenge confronting CAFA, and by extension the member states of CARICOM, is the whole threat towards NCDs, or what we call non-communicable diseases. These include cancer, it includes diabetes, cardiac or hypertensive issues, and of course other related non-communicable type diseases. And what we are realizing is that NCDs are responsible for our greatest rate of death in St. Kitts, and also morbidity, because we have too many people in this small population of 50,000 who are presenting with cancer, with diabetes, obesity, heart disease, and most of these are interrelated, because very often when you have somebody who is morbidly obese, that person more than likely is a case waiting to happen for diabetes, especially type 2 diabetes, which is adult onset diabetes that really does not present itself until you get up into your 30s or 40s. And then those are the types of individuals who also end up with cardiac issues, starting with hypertension, because the bigger you get, the more pressure you put on your heart to pump blood to all parts of it, and it puts more pressure on it. Okay, because remember, the heart is a muscle. So the bigger you are, the more work you put on it in terms of meeting that need for oxygenated blood all the time to feed your brain and all of your other organs. So what we are finding is that by extension, we also have increased cases of amputations as it relates to the issue of diabetes, especially for persons who are either in denial about their diabetes or having been diagnosed accurately as being diabetic. They refuse to follow medication and follow the regimen that the healthcare providers have given them. So what you find sometimes is that they don't pay attention to things like peripheral care, like especially foot care. So if they're not careful, they might go out barefoot, step on a nail, ignore it, and then very soon you've realized that gangrene has set in. So when you hear of cases where people go to JNF or to Alexandria in Nevis and they have toes removed, a foot removed, an entire leg removed, it's a case of diabetes that has gotten out of control. And the amputation is really your last resort to make sure you save that person's life, and you hope that by extension positive behavior changes will take place so that they could continue to live a reasonably productive life once they have been fitted with prosthesis and so forth. So it is something that we are challenged with here in St. Kitts and Nevis too, and it is for that reason why the health administration, and in particular our health promotion unit, spends a lot of time and finances and energy into bringing that type of programming to bear and advocating for better self-monitoring, better glucose testing, and regular checks for your blood pressure, to make sure that you begin to look at these things so that it just doesn't happen to you when you happen to have a stroke or a heart attack, that something was going wrong. It's better that you have your annual physical, get it done every year, and keep getting checked. We have several health centers around St. Kitts. There are at least 11 of them. In Nevis we have about 5. You're free to show up at any of these health centers. You're free to go to the outpatient department at both hospitals and also Mary Charles in the case of St. Kitts, and get these basic testing done. so that you can begin to look at those issues. And while you're there, you could also get your hemoglobin scanned at the same time, because some people might only know at that time if they have a blood deficiency, if they're anemic. We would hope by then, if they happen to have sickle cell disease, they would have known already. But the blood test will help to bring a lot of these things out. So essentially, that is the biggest threat for CAFA. Yes, we have new threats now that we have had evidence of Zika virus showing up in some CARICOM member states. And I think, if I'm not mistaken, there are a couple tests that would have gone off from here to CAFA to verify that. And essentially, it's a similar condition carried by the Aedes aegypti mosquito, the same mosquito that transmits yellow fever, as well as the whole chikungunya illness that still is confronting us as a region. And we have to basically do everything in our power to make sure that we cut down on mosquito breeding by making sure that you don't have empty containers or old tires or other receptacles that hold water that is just stagnant, so that you treat it that way. Of course, we have other interventions such as the use of fogging through the public health department, especially the environmental health workers, where we try to do those control measures. There are other things you can do in your homes too. For example, putting in screens if you could afford it, or at least buying a mosquito net. You could also use vaporizers in your homes, like the bug mat and so forth, to help cut down on the likelihood of being bitten, because you don't know which mosquito is an infected mosquito. You can't just watch it and see. And for persons who are hearing impaired, you don't get to hear this mosquito coming, even though the scientific evidence is there to suggest that it is the male mosquitoes that make the most lies. The women are the silent killers. Okay? So, but there's a lot that we could be doing in terms of our own individual response mechanism to safeguarding our own health, starting from inside of our homes and what we teach children to do. Even simple things like watering plants and having water sitting in the saucers under the pots. These are things you got to stop, because anywhere, even a teaspoon of water could be a breeding ground for a mosquito to just lay the egg right there, and then if you leave it unattended, it hatches over time. So, but that essentially is what constitutes the mandate of CAFA, and its membership is made up of the various ministries of health throughout the Caribbean. We do have international partners such as PAHO and the WHO, the World Health Organization, and we have other strategic partners, especially research laboratories, partner agencies in South America that are like-minded. And of course, our biggest challenge is really financing, because the needs of the region continue to grow. But with that, we are also doing our best to see how well we can respond to the needs within the resource base that has been allocated to us.
You are also the Minister of Gender Affairs, and although we touched on some of the inequalities before, I want to talk a little bit more about that. What does the Team Unity government have in store specifically for women?
Well, before I answer that question, I need to clarify what we mean when we say gender. I think traditionally we have assumed that when we talk about gender, it's about things to do with the advancement of women. That might be how the gender movement began within the government, going back to the early 1980s, because if my memory is correct, the very first time we had a Ministry of Women's Affairs was when our now ambassador, Constance Mitchum, headed the Ministry of Health. That's where we had a first Women's Affairs Department. And gender in that context, coming out of global conferences later on in Beijing and so forth, were basically centered around the whole issue of the advancement of women, especially when we bear in mind the statistic that I gave you earlier about more than 50% of our households being headed by women, especially single parent women. And what we have found over time is that it really is a gender bias that we have created by assuming that when we design programs around what we call gender, that we mean women. Because the reality exists now in the prison culture that we have, in terms of the serious crime that we have in St. Kitts and Nevis, specifically homicides, that is young men visiting this violence on other young men. The prisons are overcrowded. I am sure you have less than 10 women in prison right now. The bulk of them are men, and young men probably between the ages of, let's say, maybe 18 to 45. And what we are finding is that by extension, because of the fact that these women are heading households with or without the support of men, is that the male influence is missing. So you find that they try as best as they could to rein in the kids and bring them up in a right way. But then there's some people who will tell you that it's all well and good to have a woman head in a household, but it takes a man to raise a male child. And to a certain extent, I agree with that. That doesn't mean that we have not had successful examples of men who grew up without a father figure who have become great leaders, because we have. But then I could almost guarantee you that to fill the void left by the father not being around, some other man had to step up to the plate and provide that male influence for that child, whether it's the mother's brother, the pastor for your church, a school teacher, or some other respected individual. So what we are realizing now is that our gender programs have to be balanced along gender lines. You have to have programs for women and programs for men. And by that extension, our Director of Gender Affairs, who is Miss Celia Christopher, has designed an entire week of activities that we've started a few days ago. Tomorrow I think there's a symposium at Ocean Terrace Inn where we're bringing in a speaker to speak to predominantly men who we are trying to reach out to. And of course, a lot of the good ground that we find for reaching out to our male folk would come from construction sites, especially because of the fact that most of the workers are men. You know, in terms of telling them what they could be doing to look after themselves from the standpoint of health. What could they be doing in terms of improving themselves academically and otherwise, because there's potential in everybody. So I think that is a shift that we need to see more of, to get men standing up more. You father children, you be there for them. But then at the same time, they need to know what it is to father a child, because you don't expect them to learn it by osmosis, especially if they never had a male role model around.
Correct.
Okay, so these are some of the things that we look at. What we would like to see is if we change the statistic to, in terms of having more families defined within a marriage situation. That doesn't mean that the government is going out there and telling everybody, well, hey, when you have a girlfriend or boyfriend, go out and get married. But then you would prefer if you had that type of support system. And even a lot of the studies that we have had done by religious organizations and social workers or movements, they're showing you that the chances are better. Even if you have two parents who are not married who live in the same household, the children have a better or a different or elevated sense of self. You have that balance, the gender balance in there, in terms of telling you, well, this is how you treat children. This is how a father is supposed to treat a child, or a mother is supposed to treat a child. But it also goes beyond that. It also calls for maybe shifting the approach that you have to parenting as your children grow up. Because, for example, the approach you had when they're toddlers, you're not going to have the same approach when they're teenagers and still let them do as they like. Because that is the time when you have your biggest challenges in front of you, because they're pending adulthood. And of course, waging hormones help that too. But at the same time, what we're finding is that you really need fathers to take a more concerted role in how little girls are raised, so that at the same time, you take your child out on a date. You take your daughter out on a date, take her to dinner. She could be 13, you're in your 40s or your 50s, it doesn't matter. You pull out the chair for her. You let her look at the list. I'm not telling you ask for a wine list, because here she's a child. Okay? But you could have your glass of wine and let your child pick from the menu. And you expose your children to different types of cuisine. You teach them what it is to eat in a formal setting. And you know what that does, Miss McPhail? At the end of the day, when that little girl starts dating, she will be more discerning and by extension more discriminating, because she will know that my daddy raised me in such a way that he respects me and he thinks that I am precious, and basically the same thing he showed me is what I should be looking for in a boyfriend. So don't tell me that you want me to go out with you on the strip and that you're going to have sex with me in the back of your car, and you figure you could chat about it with your friends tomorrow, and when I tell you I want to go out to eat, you pull me up in front of some bread and saltfish place and ask me what color person you want. Okay? You don't want that. I'm not saying that there isn't an opportunity for you to do that. Because you could be taking her out to dinner, you could be wined and dined, and there might be occasions when you drive around the island and you pull up by a shop like that. It is part of your enculturation in appreciating what is there. But that can't be the end all and be all. But then a young man who has not been exposed to that, he can't teach your daughter that, he can't expose her to that. And by extension, if you have young men growing up in a situation where the mother has a different man in her bed every night, and they're beating her up because she got to put up with all these things to be able to feed you, and then he grows up with the same attitude that maybe I should put my hand on a woman. What do you expect going to happen? You repeat the cycle over and over again. So I'm not saying that the government is saying that everybody needs to go out and we're on a marriage advocacy mission, but we are saying that it helps. It certainly does help. Or if the parent, the father doesn't live there, at least you should still put in the same kind of time. Because as I indicated before, I am not a parent, but I believe it's more important to spend time with your child than to spend money on your child. It doesn't mean you don't have to spend money on your child, because they're your responsibility. As I said, they didn't ask to be here. But the quality time that you invest in your child will reap dividends later on. So that even when you're gone, they have those principles and the guidance embedded in them, that they themselves have everything in them already. So that when their turn comes to become a parent, they could say, well, I learned this from my mother. I learned this from my father. You know, including the whole approach to second chances, where you might have dropped out of school for a pregnancy, but then you still end up getting a degree by the time you're 34. It might mean that you and your child end up going to college together, but so what? To me, I find that is a great testimony for telling children about perseverance. I happen to have gone to college with a woman who went there when she was already in her 50s, and she carried her daughter who was 18 and her son who was my age at the time. And even though they are college students who will say, well, I don't want my mother in any college with me, but I looked at that example as a good one, because she led by example. It wasn't easy for her, but she did it. And then some children might say, well, I feel kind of self-conscious with my mother being here in college with me because I can't get to do as you like. Well, why should you feel like you're going to college to do as you like? You're going there to get a degree. And especially if you have a student loan to pay back, you better go ahead and pass with good grades to pay back the people their money. You know? So it's about keeping it real and showing children that the same standards you have for them, that you have for you too, and you lead by being your child's best role model. So that is what the approach of the Department of Social Services, especially Children's Services, is all about. In terms of letting children get the chances they need, but at the same time you empower parents to meet the needs of these children. And by extension, you empower families.
About the holistic development of each individual.
Exactly.